friends, and welcome to our presentation of the musculoskeletal system. Today, you will learn about the functions and composition of the musculoskeletal system, lifestyles that can harm or benefit the system, some tips about the maintenance of the system, plus some insights from a community expert regarding the musculoskeletal system. Now, you may be asking, what exactly is the musculoskeletal system? As we can infer from the term itself, the musculoskeletal system involves the functioning and the general makeup of the inner skeletal layer, as well as the outside layer of muscles found within the human anatomy. The musculoskeletal system consists of all the bones, cartilage, muscles, joints, tendons, and ligaments found within a human body. The bones provide the body with a framework, giving it shape, support, and much-needed protection for internal organs such as the lungs and liver. Muscles function as fibers that create deliberate motion of a body part, or involuntary movement, within an internal organ possible. Some people view the muscles and bones as two separate systems that work very closely together. There are three categories of muscles present throughout the human anatomy: voluntary, involuntary, and cardiac. Voluntary muscles allow conscious movement of a body part. A person walking expresses voluntary muscle movement. Involuntary muscles are located within certain internal organs, such as the esophagus, the swallowing tube, in which muscles contract to help move food downward. Cardiac muscles are found within the heart, an organ whose movement is a constant pumping action. The bones of the musculoskeletal system are categorized according to their appearance or shape: short, long, flat, and irregular. For example, the humerus, or bone of the upper arm, and the femur, or thigh bone, are long. The vertebrae, which functions to protect the spinal cord, remains irregularly shaped. Joints are also involved in the deliberate motion of a body part. They are the places where bones articulate, such as the elbow or knee. Cartilage is a strong and tough tissue that covers joint ends, and it helps to form some parts of the body, such as the outer ear. Tendons are pieces of tissue that connect muscles to bones, and ligaments connect bone end to matter. This connective part of the musculoskeletal system not only allows for the power of movement, but also permits a person to have a specific range of motion. Bones store salts and metabolic materials and serve as a site for the body's production of erythrocytes, or red blood cells. Red blood cells deliver oxygen to the tissues and return carbon dioxide from the tissues to the lungs. Although densely structured, bones are living tissues that, if fractured, can cause the loss of enough blood to bring on hyperfusion, also known as shock. A surprising amount of blood can be lost from a broken bone.
Musculoskeletal pain is pain that affects the muscle, ligaments, and tendons in bones. What causes musculoskeletal pain? The causes of musculoskeletal pain are varied. Muscle tissue can be damaged with the wear and tear of daily activities. Trauma to an area, such as jerking movements, auto accidents, falls, fractures, sprains, dislocations, and direct blows to the muscle, also can cause musculoskeletal pain. Other causes of pain include postural strain, repetitive movements, overuse, and prolonged immobilization. Changes in posture or poor body mechanics may bring about spinal alignment problems and muscle shortening, therefore causing other muscles to be misused and become painful. What are the symptoms of musculoskeletal pain? People with musculoskeletal pain sometimes complain that their entire bodies ache. Their muscles may feel like they have been pulled or overworked. How is musculoskeletal pain diagnosed? Your doctor will conduct a thorough physical examination and medical history. In addition, your doctor may perform diagnostic studies to confirm the diagnosis. How is musculoskeletal pain treated? Different types of manual therapy or mobilization can be used to treat people with spinal alignment problems. For some acute musculoskeletal pain, these techniques have been shown to speed recovery. In patients with musculoskeletal disorders such as fibromyalgia, medications to increase the body's level of serotonin and neurotransmitters that modulate sleep, pain, and immune system function may be described in low doses. Some of the medicines used to aid sleep include Ambien, Lunesta, and Rosarim.
Some of the most common health complaints involve the musculoskeletal system, from back pain to arthritis, to osteoporosis and joint pain. Musculoskeletal problems can stem from chronic diseases and syndromes, such as fibromyalgia and rheumatoid arthritis, to acute injuries like a pulled muscle or sprained ankle. I will share with you 5 treatments and exercises that will prove beneficial to the health of the musculoskeletal system. These include yoga, structural integration, warming up and stretching correctly, nutrients, and the acronym MEAT, or movement, exercise, analgesics, and treatments. Number 1, yoga. Yoga helps stimulate the strength and health of the muscles, bones, and connective tissues. Through different asanas or poses, yoga helps to gently stretch muscles and connective tissue, resulting in more flexibility throughout the body. It helps develop bone construction and promotes bone flexibility through weight-bearing exercises. It increases your ability to balance and helps build muscles. Another way to benefit the health of your musculoskeletal system is to warm up, cool down, and stretch correctly. Throughout the principles of dynamic stretching, the body should first be warmed up aerobically, such as jumping jacks, jogging, or cycling. Then stretching is done while moving at the same time. Dynamic stretching better prepares the body for exercise and increases both strength and flexibility. Static or prolonged and controlled stretching can prevent injuries and support the health of the muscles if it is done after you exercise, not before. Next is structural integration. Structural integration is a specialized type of massage. It is very effective at addressing various types of pain. Practitioners use body postures and sometimes muscle link testing to determine the root cause of problems for individuals. Sessions are generally focused on one area, and practitioners often have advanced training in how to address particular pain patterns in the body. Many nutrients are needed to keep the musculoskeletal system healthy. Here are 3 especially beneficial nutrients for the musculoskeletal system that many people are deficient in. Vitamin D3. Vitamin D3 is essential for the health of your bones. Low vitamin D3 levels put women at risk for osteoporosis. Also, research has shown that women with osteoporosis need higher levels of vitamin D3 than is currently recommended. Magnesium. Magnesium performs over 300 different actions in the body, including supporting the nervous system, bone health, and muscle health. Magnesium can be found in green leafy vegetables. Calcium. Found in foods, not pills. Calcium is undoubtedly important for health in the musculoskeletal system. The best way to get calcium is through foods such as dairy products, leafy green veggies, or even stinging nettle infusions. Calcium, taken in supplement form, has been repeatedly linked to cardiovascular disease, so it is best to ingest calcium through nutritious foods and to remain alert when dealing with calcium supplements. Movement, exercise, analgesics, and treatments, also known as the acronym MEAT. Moving an injured area, using gentle exercises, using pain relief besides anti-inflammatories, and treatments such as massage and physical therapy are far more beneficial to tendon and ligament injuries. This generally includes applying heat to the area as well as herbs that move the blood. Instead of congealing the fluids around the injury, the fluids which contain the ability to heal and repair tissues are encouraged to move in and out of the place of injury. What we can conclude from all of this gathered information regarding the musculoskeletal system is that this system involves 2 separate regions: the bones, the muscles, and how deliberate and involuntary motions, such as walking and swallowing, help us in our everyday lives.
How to prevent MSD. Warm up and stretch before starting activities that are repetitive, static, or prolonged. Take frequent breaks from any sustained posture every 20 to 30 minutes and stretch any stiff muscles. Respect pain by changing positions or stop whenever activities cause pain. Recognize early signs of inflammatory process and treat them early. Only use splints and wrist supports after instruction by your physician or therapist. Use the largest joints and muscles to do the job. Use 2 hands to lift rather than 1, even with light objects and tasks. Slide or push objects instead of lifting them. Keep reaching to a minimum. Position objects close to the body with easy reach, and carry objects close to the body at waist level.